Hi everybody, it's Honest John again. Now, if it weren't for the shutdown of the government done by the Republicans and the fact that they're risking our whole economy by creating a crisis around the debt ceiling, the big story this week would have been the problems that the rollout of Obamacare is having. And obviously it was a pretty big screw up. The websites were not adequately prepared for the volume of traffic they were receiving. Although that is also another interesting point, is that because those websites are being flooded with people interested in the obtaining affordable insurance care, obviously the American people are not dead set against the Affordable Care Act as the Republicans would like everybody to believe. Now, I'm not a big supporter of Obamacare. Never have been. I've explained it before, but let me sum it up real quickly, well, as quickly as I can, by saying this. First of all, Obamacare is an improvement over what we had before. And there are no death panels. There is no plan to ration health care. And it is absolutely not a government takeover of health care. Exactly the opposite. The private insurance companies and hospitals will actually benefit the most from the Affordable Care Act. The people who say these things about death panels and this and that and the other thing are either incredibly dishonest or incredibly stupid. If you think end-of-life planning is a death panel, you're just not really bright. The fact is, the Affordable Care Act originated with conservatives. It was first proposed by the Heritage Foundation. Bob Dole campaigned on something very much like it back in the 90s. The problem with the Affordable Care Act is that it still leaves insurance companies in control of health care. The policies they design are not intended to give patients the best possible results. They are designed to maximize the profits of those companies. It does end their most egregious abuses and provides some decent benefits, but it doesn't address the fundamental problem in our system. Most insurance plans will still leave the patient vulnerable if they have a catastrophic illness or a severe accident. These people will still be likely to lose everything, even though they have spent years paying money into the system. Also, it still burdens businesses with healthcare costs, making them less able to compete internationally with foreign companies who don't share that burden. The real irony of all this is that those nations, whether it's England, Canada, most of Asia, most of Europe, even Russia, have a more sensibly designed healthcare system than we do. We're the country that is having a healthcare crisis, not those other countries. And the reason is simply that we have a badly designed system, not because of hospitals or doctors, but because of the insurance companies. Insurance companies need to make a profit. That's their goal, not to provide you with good care. There are hundreds of insurance companies, all of whom employ obscenely overpaid CEOs and other executives who simply drain millions of dollars out of the healthcare system. If you have to pay a CEO $100 million, then that means that you have to make $100 million before you make a profit. A single payer system just makes more sense. But we have people who somehow believe, and they can't explain it if you with facts, if you try to get them to, is that government provided health care, single payer health care, is synonymous with oppression. And yet all around the world, countries that are smart have single payer systems, and their people don't seem to be particularly oppressed. The idea that providing health care is oppression is simply ridiculous. Now, under a single payer system, we would still have private health care providers. It would just be that the government would be the payer, and that would make it easier to set up a system where the amount charged for services would be based on their actual cost. Right now, the difference between what a procedure costs can vary by thousands of dollars depending on where you go to get it. People would not spend their lives paying into the system only to lose everything if they got sick or had an accident. And our businesses would be more competitive internationally so that more jobs could be created and they could actually pay a little better. Now, of course, it would have to be paid for by, oh, and here's that awful word that people hate, taxes. But this would spread the burden over much more widely over the whole country. So the amount of taxes you would pay would be much less than your health insurance premium. The problem with Obamacare is not that it's a government takeover of health care, but that it isn't. Thanks for listening.